Because I think most people's experience of trying to get a GP appointment at the moment is it's like trying to get festival tickets. You have to wait on the phone for hours and hours. You have to plead with receptionists, kind of describing your details in gory kind of detail just to get, 5 minutes with the doctor. It's a little bit more complicated. So what's actually happening is that, back in 2001, as the Times reports, the average workload for a GP was around about 48 hours. It's now, the average is around about 38, and that was a survey done last year. So it's come down a bit, but a fifth of GPs are only working 26 hours a week, and they're making up their other time with paperwork, but also doing external things like research projects. And it's sort of an effect of, as GPs would put it, the kind of burnout that lots of them just cannot handle the workload that's coming at them from more and more people wanting appointments. Some of the solutions that have been suggested in the Sunday Times is that they cut some of their paperwork. So it does seem ridiculous that you've got a trained clinician filling out appointment forms or something. I mean, a lot of it will be, you need some expertise to do some of the paperwork, but it seems like that could be passed on to the front desk. But there's another aspect to it, which is that, before the pandemic, 80% of appointments were face-to-face. And now that's come, fell down to 50%. Now it's around about 60%. But there is still a problem with, I've been fobbed off many times with telephone appointments, and you just know that you need to see someone. I'm pregnant at the moment, and I haven't seen, it's not just GPs, I have not seen the same midwife twice in my entirety of 7.5 months.
Is not good.
I know, it's really not good. And the same with, there is, the Times reports that there are people going private with the specific desire to see the same person twice, paying to simply have a relationship with someone.
But what I don't understand is why they say it's not feasible.
Yeah, that's what I can't understand. If GPs are choosing to have what they're calling portfolio careers, they're doing other things, they're doing consultancies, they're doing university work and things like that. If they're choosing to do that and to keep their hours as a GP down to 26 a week, that's their choice. It's not that it's not feasible.
Yeah, and you have to take into consideration also that the average pay for GPs is £100,000 a year. So this isn't kind of, it's not hard, back-breaking labour for 25 grand a year.
Doesn't it highlight the ludicrous situation we're in? When the NHS was set up, they legitimately believed that public health would improve over time and the cost of the NHS would fall. We keep moaning on about the involvement of the private sector in the NHS. All of these GP surgeries are private sector healthcare companies, whether they be sole traders or whether they be a group of GPs together. The reality is we are putting GPs or we're putting trained doctors in the place where they're not needed. They're needed in hospitals. They're not needed to basically dole out penicillin to sick children who are just wandering.
I don't know.
Who does it? They don't.
Well, nurses. Without a doubt, we do not deploy our nurses in a sensible way at all. I genuinely don't believe that we should be training people for 12 years to do what is effectively a relatively easy job as a GP. And I make that point because the minute you come across a challenging case, you're able to refer it to a specialist. The specialists, the people taking on the more challenging cases, should be the doctors. You would cut waiting lists massively if you did that. Now, there would be a cost associated with having more nurses in the community, but I genuinely think it's worth paying.
Oh, I don't know if I can agree with you on that one.
I think a lot of people, the point, you're right to say that a lot of what GPs do is signposting. So they just, they see a lump and they send you on to the specialist and that's what you want. But it's also the case that there's, part of the problem with the telephone appointments is that you need to have a certain level of specialism in order to know that the pain in your throat is not just a sore throat, it's cancer or things like that. Yeah. And so, it just seems that so much of this problem is as you say, is a staffing crisis. But part of the question is, feasible is an interesting word to use. What is it that young people need to be able to entice them into the role of getting involved in healthcare?
So just if they're doing 26 hours a week rather than 36 or 48, are they still getting the full whack salary?
Oh, well, that isn't outlined in the Times, I'm not sure. But the idea of research projects and things like that, there are benefits to them because if, expanding knowledge and things like that, but there has to be a balance.
I think the other point that I'd make, which I accept that my views are controversial on this, but I've got a friend of mine who's a nurse in a hospital, and she said one of the big problems they have with junior doctors is the BMA have got all these rules on what a doctor can do and what nurses can't do, and it's based on effectively a time when nurses were very lowly skilled and lowly trained. They're now highly trained medical professionals in their own right. And of course what happens is the nurse knows what the patient needs, but legally the junior doctor has to administer it. So what happens is the junior doctor whizzes round the hospital doing 60, 70 hours a week, doesn't really see any patients properly, and it's purely effectively to satisfy a trade union agreement with the BMA, which is totally crazy. We've got these healthcare professionals in the form of nurses, we just don't use them.